Angie, in today's cover story, the Centers for Disease Control will soon implement new health screenings at U.S. airports. That's after the first Ebola fatality in the U.S. connected to the West African outbreak. Thomas Eric Duncan succumbed to the disease Wednesday while being treated at a hospital in Dallas, Texas. He was 42. Thomas Eric Duncan traveled from Liberia to the U.S. September 19th. On his pre-flight questionnaire at Monrovia Airport, he reportedly did not declare that he'd helped transport an Ebola patient for medical treatment who died soon thereafter. President Obama reiterated that the U.S. is sending personnel and supplies to help fight the epidemic in West Africa.
We are doing it in a way that ensures our men and women in uniform are safe.
In addition, the Centers for Disease Control says it will begin screening passengers at U.S. airports. Details have not yet been released, but published reports say they'll factor a passenger's recent travel history, particularly through West Africa, their body temperature, and any outward signs of illness.
I think it's a good idea. I think it would be tough to manage.
I live in Dallas, concerned about the outbreak, and feel that's, we might rather be safe than sorry.
Duncan did not show signs of the virus when he traveled, and skeptics say a fever is no guarantee that a passenger has been exposed to Ebola. But aviation analyst Joe Schwieterman says that the number of arriving passengers screened at U.S. airports will likely be low.
The African market is minuscule compared to what we've had in the past with the Asian flu disease and so forth. So I think this can be done without massive delays, massive staffing up at the airports.
World Health Organization says Ebola has killed more than 3,400 people in West Africa, including 370 healthcare workers. The International Air Transport Association says global share prices for airlines fell 4% last month. Trade Association for Air Carriers blames investor concerns over the spread of Ebola.